Hello, 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 everyone. Welcome to this episode of Ask Dr. Dansinger, Ask Dr. Michael Dansinger. Of course, you can subscribe to his YouTube at it's youtube.com, the sign forward slash the at sign, Michael Dansinger MD. And make sure that you like this video, you subscribe to the channel to learn more about eating healthier to stop your arteries from being on fire. Today's topic is all about diabetes. It's a huge factor in leading to your arteries being lit on fire. Every sugar molecule in there can actually be a fuel to the fire, to the flame that's damaging your arteries and mucking it all up with plaque and all that jazz. But there are a lot of things that you can do to help reduce your risk of cardiovascular and vascular disease due to diabetes and ultimately getting that diabetes under control. That's really the big thing that you got to do to reduce those risks. And Dr. Danziger is here to talk about medications. You see the Jardiance commercials over and over and over again, and the Ozempic commercials over and over and over again. And so you go to your doctor like they tell you to do, and the doctor is like, nope, those aren't right for you, or those are right for you, and sure. But how do you know? What are these different medications? Are they in different classes? Who are they for? Well, Dr. Danziger is going to break things down for us. And he is with Diabetes Reversal Partners. He has a practice out of New Hampshire, Massachusetts, and Florida. So if you're in those states, you definitely got to look up his diabetes reversal program because it's incredibly powerful and it's helped many of our patients reverse their diabetes and improve their vascular and cardiovascular health. All that being said, let's dive deep into those medications, Dr. Danzinger.
Okay, great. Thanks, Kim. Thanks for those kind words. Yeah, I'm excited to talk about, diabetes, especially medications. So, just by way of background, I'm trained in primary care internal medicine, and I've prescribed many, drugs and medications, including for diabetes. But I stopped prescribing medications over 20 years ago because I feel, you know, nutrition and lifestyle is the primary treatment for lifestyle diseases, including type 2 diabetes and heart disease. And medications are very important, but they're secondary to lifestyle. And we just need more doctors who are good at prescribing lifestyle. But sometimes lifestyle is not enough, or we need a combination of lifestyle plus medications to get the job done. And so let's talk about diabetes medications. So, insulin shots or insulin pump is a crucially important medication for people with type 1 diabetes. And we also use it in type 2 diabetes, generally when we've run out of medications to prescribe. And so metformin is usually the first medication that's prescribed when lifestyle is not enough. And metformin's been around a long time. Metformin typically lowers the A1C by about a point. For example, from 8.0 to 7.0. Metformin's a pretty powerful drug. It works mainly by reducing insulin resistance, so it works best in people who are carrying excess body weight, which is the majority of people with type 2 diabetes. And it has side effects. Gastrointestinal side effects are the common ones. Uh, it can cause loose, diarrhea or stomach upset or similar gastrointestinal side effects. Those usually go away, after a few weeks or after a month. Most patients tolerate metformin pretty well, and then they gradually increase the dose. I would say metformin is typically the first one to add and the last one to get taken away. Then the second line medication for many decades was sulfonylureas. An example would be glyburide, and those have really been falling out of favor. Many patients are still on sulfonylureas like glyburide, and what they do is they cause the pancreas um, it pushes the pancreas to make more insulin. And side effects of the sulfonylureas include increased appetite and some weight gain. And there's some research to suggest that it it might speed up the demise of the insulin producing cells of the pancreas. So it might actually, in the long run, make the diabetes worse. But in the short run, when you start taking sulfonylureas, they're very effective for lowering the hemoglobin A1C and the blood sugar, um, maybe even stronger than metformin. But they don't seem to have some of the cardiovascular advantages that some of the other drugs have. So um, we've been hearing more and more about the GLP-1
Mm.
receptor agonists, and everyone's heard of Ozempic. And another one is Mounjaro, and Ozempic and Mounjaro are um, the latest, most effective um, diabetes medications, and it is fair to call them game changers. Most doctors who are in primary care or in endocrinology would strongly agree that these two drugs, Ozempic and Mounjaro, are game changers because of the amount of weight loss that they can achieve, and they can often replace the other medications. They're that effective in the right person. So a person can lose weight and lower their A1C all the way to normal through lifestyle change, but for many people it's too hard to do it. It's just they they just can't get their diabetes into remission without medications. And so more and more patients are being prescribed Ozempic and Mounjaro, which are called semaglutide and tirzepatide as their generics. And we've seen commercials on TV for these medications. And it's not unusual for someone to lose 30 or 40 pounds on these medications. There's no other drug that's been able to achieve weight losses of 30 or 40 or more pounds on a pretty consistent basis. But it's not for everyone. So it's mainly for people who have um, type 2 diabetes or are at have weight issues and are at increased risk for heart disease or diabetes because of their weight, and they cause side effects. So you have to start them at the low dose. And these are weekly injections. And at the low dose, they might cause just a little bit of queasiness, stomach upset, diarrhea, abdominal cramps are the common side effects. And then after about a month, you increase the dose a little bit more, and then after another month increase the dose a little bit more, and to try to get to the full dose. And as you approach the full dose, you notice that when you sit down for a meal, you're not as hungry anymore. It's as if you've eaten half the meal already. And so it becomes much, much easier to stop halfway through the meal. And it it patients describe it as, turning off the food noise, meaning they just don't think about food or having a snack in the way that they used to. It's as if you're already full, and people eat fewer calories, and that's what causes the weight loss. So they just eat less food. But it's important to keep eating healthy food rather than junk food or soothing food. And so that's a challenge that patients face who are on these medications. And what I do as a lifestyle coach is help people who are on diabetes medications to minimize the side effects and to get the maximum benefit from their medications.
But it's not a replacement for eating healthy. And there are a lot of patients that will say, I don't want to make those lifestyle changes myself. They're too difficult. I enjoy my cake and eating it too. And I know that was cheesy, but I want the medication so that I can continue to eat the hamburger, eat the French fries, eat the cakes in the amount that I desire and other desserts. And That is not a good way to think. That's not going to solve the problem. The
Yeah,
medications are not the end all be all.
no, absolutely. And so we don't want patients making the mistake of eating unhealthy, figuring, well, I'm on this drug now, problem solved, I can eat what I want. That backfires. So that prevents the amount of weight loss that someone would otherwise get. Also, eating that way promotes loss of muscle. So when you lose weight, you want to lose fat, but not muscle. And so you need to eat healthy food, including healthy proteins and vegetables and fruits, in order to keep your body healthy and minimize the muscle loss and focus on fat loss. And then you want to build up the skills to be able to discontinue the medication at some point, which means learning how to eat healthily and eat mainly home cooked food and to exercise while you're losing the weight with the help of the drug so that you can eventually discontinue it and maintain most or all of the weight that you lost while on the medication.
If you have any questions, make sure you do put them in chat. We do have one that's coming in from Nona, who is watching on our Facebook channel, and she's asking about terzepatide.
Yes, tirzepatide is also known as Manjaro,
Oh, that
and
is Mounjaro.
yes, and in my opinion, that's the number one most effective drug we have for weight loss and diabetes right now. And so I think, research studies, from my review of research studies, um, I would choose it as the number one, slightly more favorable than Ozempic. Ozempic gets is more of a household name, but tirzepatide, also known as Manjaro, is probably slightly more effective. I've seen it come through for patients even when Ozempic was mediocre for them.
And Kelly is watching on YouTube, and Kelly is wondering about, it is really tough to start on these diets and stick with them because you don't lose the weight as quickly as possible, and your A1C doesn't go down as quickly as possible in her experience. Just by doing that, so these drugs can actually give you a little bit more of a reward sooner rather than later, for your efforts. So it would incentivize you down the road to continue with these lifestyle modifications. It kind of gives you that little bit of a jump start with seeing that reward sooner rather than later, seeing the weight come off in bigger chunks versus a piece of a pound here and a piece of a pound there.
Yes, the combination of healthy lifestyle choices, eating and exercise, plus the medication works better than either one alone. So I would say the two go together hand in hand.
Mhm.
And when lifestyle alone is not enough, I am enthusiastic about the idea of adding a GLP-1 receptor agonist to a situation. However, lifestyle is often sufficient. And so it's hard for patients without adequate support to get the job done. But with coaching, and if they're able to put themselves in the right um, environment, lifestyle can work wonders, and it can work quickly. And so I always encourage patients to really give lifestyle a chance if they can do it before starting any medications.
So it kind of flips it. Yes, you might have a quicker result if you start the medications, but it's better to still start with the lifestyle modifications, see what you can do, and create a more sustainable long-term result because you're developing the skills.
Different strokes for different folks, and that's the way I like it. There's no one best answer for everybody.
What about DPP-4 inhibitors that increase your body's own insulin boosting hormones?
Yes, and so DPP4 inhibitors, an example would be Januvia or Tradjenta. These, you can think of them as being a mild form of Ozempic or Manjaro. So they work not identically, but similar. So it has favorable hormonal effects on the insulin producing beta cells of the pancreas, and they don't have as potent of an effect, but they also have fewer side effects, and it's a daily pill. And so yeah, DPP4s, you can think of it as a gentler oral form of Ozempic or Manjaro. There's another very important type of drug that is the SGLT2
LT,
inhibitors.
the
So
ones that help
examples
you
would be
pee out your extra
Jardiance.
sugar.
Pardon me?
The ones that help you pee out the excess
Yes,
sugar.
that's right. Farxiga or Jardiance would be common ones. And I've seen commercials for Jardiance,
A lot.
and it's a very it's a very catchy commercial.
Just one day is the song it's in my head.
Lowering my A1C.
A1C.
So these are good medications. I would give them the silver medal when it comes to, behind the GLP-1 receptor agonists. These SGLT2 inhibitors cause you to rid yourself of excess sugar through the urine, and they have favorable cardiovascular effects. They have favorable effects on the kidneys, and um, for patients who are struggling to get their A1C below 7, I think those are the second best drugs after the GLP-1 weekly injectables.
And at what point do the doctors turn to insulin? It's kind of like when everything else doesn't work, you then turn to the insulin for type 2 diabetics. And the
Yeah.
issue I have with insulin is I've seen it's harder to get off the insulin than it is some of these other drugs.
So insulin, you know, is a weekly injection in most cases. Some people use an insulin pump that is attached to their skin, and insulin in type 2 diabetes is typically used after someone's been on maybe three different types of other medications. And if three medications aren't enough to control the blood sugar to get the A1C under 7, then insulin is typically used. And sometimes that allows a patient to be on less of the oral medications. But um, insulin insulin is something that most people with type 2 diabetes can avoid if they're able to really focus on lifestyle and try to lose weight and to eat right and to exercise. So not everyone can get their diabetes under control without insulin, and it's a very important medication, but it can cause increased hunger and appetite and weight gain, and um, it it becomes difficult to get out of a bad cycle when you're on insulin. Then, if you're gaining weight, then you just end up needing more insulin, and no one wants to
It's
take
a
daily
vicious cycle.
injections if they can't help it. And so, I've dedicated my career to helping people with diabetes, type 2 diabetes, to um, turn it around so that they're on the least amount of medication possible. I want that A1C as close to 6 or less, and I want the least amount of medication to do that.
Yeah. And so, is there a pathway in your experience when it comes to insurance companies, such as with statins or with drugs to reduce acid, where they say you need to start here and then you can progress to the different drugs. So if this doesn't work, if the metformin doesn't work, then we're going to move to the SGL2s, and then we're going to move to the GLP-1s, or and then we're going to move to insulin. Or is there a direct pathway for most insurance, especially Medicare, to go directly, let's say, to what you consider the gold standard, the game changers, the GLP-1s?
So when it comes to inexpensive drugs, you know, the insurance companies who are paying the cost of the drugs generally don't interfere with what doctors want to do as best practice. Once we're talking about very expensive medications, then insurers often create rules that say you have to have tried some of the inexpensive first line medications before we're going to authorize expensive medications. And they do that for many reasons. The main one is so that they don't have to keep raising the premiums for everyone's insurance. And so they have, they put a lot of thought into when they create rules, but every time they create rules, it causes unintended consequences, and it makes it difficult for patients who need certain medications to get them without having to jump through hoops and barriers, and it's difficult for doctors. So I think insurance companies try to be the as least prescriptive as possible, but I can see why they have rules that say, well, you have to have tried metformin and at least one other drug before we're going to allow someone to take Ozempic or Manjaro because of the costs. On the other hand, though, um, the insurance companies generally follow in the footsteps of what Medicare has for rules, and Medicare typically follows the evidence guidelines from societies like the Endocrine Society. So it's a moving target, and
And
it
based
changes.
on all of what we've learned, about all the different medications here in the last, 20, 25 minutes, what are the critical questions that patients can ask their doctor to have a more productive and satisfying discussion about these medications and what may be right for their presentation of disease?
So it's a great question, and first of all, having honest, productive dialogue between a doctor and a patient is crucially important. And so gone are the days where the patient just listens to what the doctor says without, it's not that it needs to be a dialogue. It's not, okay, doctor, I'll just do whatever you say anymore. It's, well, doctor, help me understand the pros and cons, and what are your recommendations, and what are the alternatives, and do I absolutely need this medication? What are the risks of not taking it? What are the risks of so having dialogue is important. Also having a second opinion sometimes about things that are going to affect you for years. Sometimes that's important. So getting multiple opinions, um, and then just you don't want you need, in my view, you want to do whatever it takes to get your blood sugar close to normal. And if, lifestyle first and then medication second. And so a question you want to ask your doctor is, what can we do so that I can leverage the healing property of vegetables and healthy foods as much as possible so I can keep my medication to the minimum? I think that's a very important question to ask. And when you ask a question like that, healthcare providers often get very excited because they want to prescribe the least amount of medication necessary, but sometimes it's easier to prescribe the medication. So asking about side effects, and then when you are tempted to decrease or discontinue a medication, that's also, you don't just stop a medication. You have a conversation with the prescribing clinician about your thoughts on that, and you negotiate. But in the end, we as individuals are in charge of our own bodies, and we should understand why we take any medication that we take it, and it's um, it it needs to be an ongoing conversation. And so if you don't feel comfortable that your healthcare team can have dialogue like that with you, then I think you need to create the opportunity for dialogue or change healthcare providers if need be.
And we always suggest that when with any prescription drugs that you may be on, to set up a follow-up appointment every 6 months to get additional blood work to make sure that it's not causing any other mineral or nutrient deficiencies in your body that need to be made up, and also to reassess where you're at in terms of your progress. Are you experiencing any progress being on this drug? What are the side effects you might be experiencing? And make sure you do have that continued conversation. Don't just, as Dr. Dansinger said, stop taking the drug. You don't want to fall through the cracks. You don't want to be on a medication longer than you need to. So, setting up those follow up appointments on a regular basis is really important, and asking for that additional blood work. And then, secondarily, as part of this, Dr. Danzinger is driving home the point that lifestyle is really the most important. And music to your doctor's ears would be to say, hey, I need a referral to a dietitian. I need a referral to a nutritionist. Do we have a diabetes reversal program as part of this healthcare system? All your insurance, do you have a diabetes reversal system such as Virta Health that's part of our insurance plan? They don't put that out there, but you need to ask the question to make sure that you know what you have access to, because there's more than you realize. You may even be in New Hampshire, Massachusetts, or Florida, where Dr. Danziger has his diabetes reversal partners, and your insurance would cover his program as well. So just ask those questions, do your research, and really do everything that you can to take your health into your own hands. Dr. Danziger, thank you so much for being here. I know you're tight on time. Again, make sure you like this video, subscribe to his channel. It's youtube.com/@ Michael Danziger, MD. And thank you everyone for joining us. And final thoughts, Dr. Danziger, as we head out.
My final thought is to you, Kim, for your leadership and the Global PAD Association and the opportunity to have these dialogues together. So congratulations to you and all you've been able to accomplish. We're here because of you, Kim. Thank you.